Hello everyone. As you can see, my face is a little swollen. This is the second day after surgery. Well, the next day after surgery. I was supposed to come home the same day right after surgery, but I had some complications. I had a panic attack after waking up from the anesthesia. So my heart rate was too high. And I had a fever. So I had to stay overnight for observation. So I actually just came home today. Um, as you can see, one side of my cheek is actually a little swollen than the other side. I'm not sure why it happened, but it's a little uncomfortable. um, what I can tell you so far is after a while, after trying to project your voice and talk through the adult voices, it gets tiring. So sometimes I don't want to talk. I'm actually exerting a lot of energy right now making the video. I'm taking a lot of medications, Percocets, amoxicillin, some of my regular medication already that I take. I'm also taking that too. I have this mouthwash that I have to rinse out twice a day. It's to keep the bacteria down, since I won't be able to brush my teeth on the inside for 6 weeks. And I personally, I don't want to get sick, so I have gotten the mask, so when I leave out the house, I can cover my mouth and my nose, so the chances of me actually getting sick are lower, because I can tell you right now that breathing is difficult with your mouth contained like this. And so right now, because I have sinuses, breathing is a little difficult. So I can only imagine getting sick, and it would be horrible, so I don't want to get sick. I'm also taking a stool softener. They gave me Kool-Aid, but Marilax, this Marilax is actually better because it's a powder. It's a powder that you can put in water or any type of liquid, and it keeps your stool soft, because the Percocets are going to make you constipated. But the only discomforts I'm having now, because I'm taking pain pills, is the fact that the braces kind of cut into your lip a little bit. You can see I still got a black clot from the incision. I have to drink a lot of water to keep my mouth from being dry, and I have to put Vaseline on my lips because it gets dry really fast. But so far so good. A lot of bleeding from the incisions on the inside of my mouth. I don't know if you can see. I guess some bleeding, but that's normal. Hopefully the swelling goes down. It's a little warm. But just I have to drink a lot of water to keep my mouth from getting dry. Today for breakfast, I've had Ensure. For lunch, I had a milkshake. And for dinner, I'm gonna have um like a broth and an Ensure. So a sweet and like not sour, but a sweet and a salty, just to keep my taste buds, you know, from getting tired of one or too many things. But yeah. So far not too bad, you know. But